The rapid extrication technique should be reserved for critical or unstable patients or vehicles. Examples of these patients would include actual or impending cardiac arrest, respiratory failure, decompensated shock, rising intracranial pressure, uncontrollable external bleeding, altered mental status, penetrating injuries to the head, neck, chest, abdomen, or pelvis, or a patient in an unsafe situation requiring an urgent move. Begin by taking BSI precautions and donning appropriate personal protective equipment, such as work gloves or a helmet, depending on the scene and damage to the vehicle. Attempt to communicate with the patient and let him or her know you will be helping him or her, gaining consent if possible. If the patient is altered or unable to communicate, you may proceed using implied consent. Position a rescuer in the rear seat and maintain cervical spinal immobilization. Perform an initial assessment of the patient to ensure that this is a high-priority patient and rapid extrication is the most appropriate technique to use. Apply an appropriately sized cervical collar after inspection and palpation of the cervical vertebrae and neck. Position the long spine board at the edge of the patient's seat. Ensure the other 3 rescuers are properly positioned in the front seat on the passenger side and outside the vehicle at the B post. Next, carefully start the quarter turn until the rescuer holding the head is unable to turn any further. Then, stop the turn. Carefully transfer the head and neck immobilization to a rescuer outside the vehicle and, on their command, complete the quarter turn so that the patient is now seated on the backboard perpendicular to the steering wheel. Next, lay the patient down onto the long backboard, making sure that the head and neck immobilization is always maintained and the chest and armpits are fully supported. Upon the command of the rescuer holding head and neck stabilization, slide the patient into position on the long backboard along the long axis, then move away from the vehicle to safety. Reassess patient and PMS.